Okay guys, this should be your room set up. You have your cup with your disclosing tablet in it. You have your Vaseline on top, mirror for your patient, calculator for your plaque index and your pen. Then you have your covered red pencil to actually record your plaque index. You have some dental materials back here to help demonstrate oral hygiene instructions later. You have your chart here open to the progress notes. And this will have your plaque index. This is not the correct chart. And then you have a clean paper towel with which to chart properly. Then you have your tray here. You should have a mirror, explorer, and cotton pliers. You should have your prophy paste, at least 2 pieces of floss, one for the maxillary arch, one for the mandibular, plenty of gauze. Make sure your air water tip is on your syringe, and your prophy angle. Your napkin should be on your patient, of course. Your saliva ejector should be on your side here, and then you have your fluoride ready for your patient when you're done. Okay. Alright guys, we're going to start demonstrating how to polish correctly. We're just going to show you a few things here. Always use your mirror instead of using your fingers to retract in the mouth if you possibly can. And you're going to use it to retract like this on the facials. Okay. Here's your prophy angle, and it has the little cup on the end. Before you start working with your patient, you're always going to make sure, I like to put it on my index finger if it can fit, it's kind of small. You're going to take your prophy paste and put your foot on the rheostat. You're going to gently scoop up a little paste. Should look like that. Okay. We're going to track the cheek, and we're going to start in the upper right quadrant. We're going to start on tooth number 2. You're going to pat prophy paste on about 3 teeth. Okay. Now making sure you always have a fulcrum whenever you're working. I'm going to rest down here on the chin. Retracting the cheek. It's kind of difficult on the dexters. You're going to start on the distal portion of the tooth. You're going to swipe once. Then you're going to do the facial at the gum line, the mesial interproximal, and then the other portion of the tooth at the edge. There should be 4 strokes on that tooth on the facial. So distal,